Hello, everybody. So just to start off, my research question is, will implementing virtual reality technology to manipulate direct environmental contact of aversive stimuli decrease the phobia of medical procedures in children with autism? So we'll start off with identifying our problem. Individuals with neurodevelopmental disorders such as ASD experience phobias related to medical procedures, interfering with their ability to receive adequate medical treatment. Studies have shown that specific phobias are present in up to 40% of children diagnosed with ASD. Occurrences of behaviors during procedures are more frequent due to the aversive environment where procedures are administered. And with the rise of AI, there have been several studies conducted on the topic of virtual reality. Exposure therapies have resulted in significant decrease in what is described as extreme phobias towards medical procedures for adults and children. The purpose of my study is to build a tolerance towards exposure of aversive medical environments and stimuli through manipulation of direct contact, with the intended goal that children with these specified phobias will be able to receive treatment in the absence of maladaptive behavior. To provide a general overview of related research, there are current states of this research beginning with studies integrating basic ABA principles. These principles are stimulus fading, differential reinforcement that are integrated into the desensitization procedures, allowing children with ASD and diabetes to tolerate the direct contact of needles, which are found in the Shabani and Fisher 2013 article for daily glucose checks. As mentioned, consistent therapies such as graduated exposure have been helpful in the decrease of behaviors during each visit. As with all research, there are some deficiencies, so to go over those, some of the possible deficiencies in earlier studies related to my project proposal emphasize the participant selection, mainly being a mix of adolescents and adults, focusing primarily on non-medical phobias such as spiders. With my study focusing on pediatrics and aversion towards medical environments and procedures, there may be some lack of external validity. To dive into our methods section, I will first be breaking down where the experiment will be taking place. So the general setting for this research project will take place in a research laboratory free of loud noises or any other aversive stimuli specific to participants. There will be physical items present in the laboratory such as chairs, exam tables, and a dental chair. All medical instruments will be in the VR program. The VR headset will mimic standard versions of every dentist office or PCP, which stands for primary care provider room, and will be placed upon arrival outside of the laboratory room. Note, there is no direct physical contact with the medical procedure or instruments on skin. The goal is to decrease the aversiveness of the environment with VR in attempts to reduce the phobia of procedures. To talk about participants, the relevant participants for this research project will be a selection of 3 children between the ages of 4 and 9. All children should have a medical diagnosis of autism spectrum disorder and or including a generalized anxiety disorder. Criteria for the study is based on each child's specific phobias related to enduring medical procedures and the aversiveness of actual treatment and environment. Participant A is a 4-year-old boy whose phobic related matter stems from dental cleaning and entering a dentist's office. Skill deficits to focus on include self-regulation, self-advocacy, and effectiveness to sensory stimulation. Participant B is a 6-year-old girl whose phobic related matter stems from primary care monthly checkups and entering a PCP office. Skill deficits to focus on include self-regulation and self-advocacy. Lastly, participant C is a 9-year-old girl whose phobic related matter stems from receiving flu shots at their PCP. Skill deficits include effectiveness to sensory stimulation, emotional regulation, and functional communication. Target responses for this study are entering a medical facility and sitting in a chair and on exam table without occurrence of maladaptive behaviors. And the maladaptive behaviors are aggression, elopement, or any other form of escape or avoidance from a task. The methods used for this research project will include a virtual reality headset, specifically the Apple Vision Pro. Environments on the VR headset will mimic a standard dental hygienist office and primary care treatment room. We will be measuring the duration via timer of how long each participant can withstand being in their designated environments without maladaptive behavior, as well as utilizing a task analysis, which is a simple task analysis with a headset on. The checklist will include tolerating headset for more than 10 seconds without attempting removal, entering the room or VR space, and sitting down. Maladaptive behaviors for this study are defined as elopement, aggression, or dropping as well. And aggression is limited to, but not biting, kicking, hitting, scratching, pulling. The personnel required for this study includes a legal guardian or stakeholder, as the participating individuals are minors. Guardians should be outside of the room but still maintain access to view the participant. There will be 2 data collectors. Data collector 1 will check off each step of the task list and then record the duration of time spent in the simulation without maladaptive behavior. Data collector 2 will record any instances of maladaptive behavior via frequency. Lastly, there should be an informational technology technician present outside in case of technological issues. Some of the expected findings include participants removing the headset initially off of the first simple task list task. There is a hypothesized finding that a headset might produce some restrictiveness for children of that age range. With this in mind, there are some chances that findings will be inconclusive with actually proceeding with the experiment. Therefore, that is also just a huge note to keep in mind. I do believe there will be a fluctuation of maladaptive behaviors. I don't think there will be a high increase of maladaptive behaviors once the VR headset is on, because there is no direct contact on skin with medical instruments and the environment, because it is a manipulated environment in a contrived setting. I do think that there will be age-related, typical developing behaviors involved, including whining or removal of headset or trying to attempt to get out of the chair or exam table, but that is all aged, developing typical behaviors for children of that age range. But that is it, and thank you for listening to my research proposal video. Thank you.